The broadcast is now starting. All attendees are in listen-only mode.
Greetings and welcome to the webinar, Human Trafficking. I'm Teddy Owusu, Program Coordinator for the Office of Minority Health Resource Center and your moderator for this afternoon's presentation. Today's webinar is part of the Preconception Peer Educator Program webinar series, which you can view archived on the Office of Minority Health YouTube channel. Preconception Peer Educator, or PPE, is a volunteer program developed by the Office of Minority Health Resource Center that comprises a preconception health training curriculum, volunteer opportunities, and educational webinars through which participants can become certified as peer educators by the Office of Minority Health. Our presenters today are Dr. Rochelle Rollins and Kelly Cody. Dr. Rollins is currently the Acting Deputy Director of the Office on Human Trafficking in Persons for the U.S. Department of Health and Human Services. She formerly served as Director of the Division of Policy and Data in the Office of Minority Health, where she oversaw efforts to improve health disparities, research coordination, evaluation and performance measurement, and data collection and reporting and implement Healthy People 2010 and 2020. Prior to joining the OMH, Dr. Rollins worked as Special Assistant to the Deputy Director of the National Institutes of Health, National Cancer Institute, and helped to establish several cancer initiatives in the Health Resources and Services Administration to galvanize community health centers to excel in cancer screening, diagnosis, and referral for treatment. Dr. Rollins received her Bachelor of Science from Wellesley College, her Master's in Public Health from Boston University, and her doctorate from Brandeis University's Heller School for Social Policy and Management, where she was a Pew Health Policy Fellow. Our next speaker, Kelly Cody, is an advocate, leader, and thriving survivor of human trafficking. She's the author of the book, Who Am I? Discovering the Value and Worth of Women, and the founder and president of She Inc., a nonprofit organization developed to strengthen, heal, and empower men, women, and youth who have been impacted by violence. Kelly received a master's degree from California State University, Long Beach, and completed her thesis on women of faith and intimate partner violence. She is currently pursuing a PhD in psychology with a dissertation emphasis on human trafficking. Kelly has worked on several projects for the United States Department of Health and Human Services, including serving as a panelist on the service's task force to prevent and end human trafficking. As a member of the technical work group for HHS, she worked on the pilot for the SOAR to Health and Wellness training on human trafficking and facilitated the training. She also assisted in the development of the Look Beneath the Surface campaign and has participated in anti-human trafficking trainings with the United States Attorney's Office. We will hear from our guests shortly, but before then, please note that all attendees' lines are on mute. You may communicate with staff and our presenter during the webinar using the questions window located on the GoToWebinar control panel. This will be an interactive webinar. Please be ready to respond to the in-session polls. Secondly, we will stream a video during the presentation. You will only be able to hear the sound from the video from your computer audio and not the phone. So take time now to adjust your computer settings. We will have a Q&A session with our speakers immediately following the presentation. This webinar is being recorded and will be made available along with the webinar survey via email after the broadcast has concluded. Slides of today's presentation, as well as other materials, are located in the handouts window of your GoToWebinar control panel and also available upon request. So without further ado, I will hand things over to Dr. Rollins.
Thank you very much, Teddy. I want to thank the U.S. Department of Health and Human Services and Office of Minority Health for inviting Kelly and I to focus this webinar on human trafficking and pregnancy. I want to thank my co-presenter, Kelly Cody, for joining me. So I wanted to start first with a quote from a very famous poet and civil rights activist, Audre Lorde. And she once said, "There is no such thing as a single-issue struggle because we do not live single-issue lives." So this webinar brings together the issues of the impact of health disparities, and health equity as we look at the topics of human trafficking and unplanned pregnancy. The objectives for this webinar are on the screen. There are 4 of them. We're going to give us some background on human trafficking. and the variety of perpetrators or traffickers that exist in the U.S. Our presentation will be all focused on the U.S. We'll talk about recognizing high-risk factors and common indicators. We're going to then focus in on the health and pregnancy issues, and then end it with some referral resources that are health and education and social science based. So why is this webinar important? We wanted to help these peer educators, peer conception, peer educators, and others to know how to interact with the youth in order to prevent and end the human trafficking. Trafficking is a very lucrative business with a high demand and a big return on investment. A pimp or trafficker can and will resell his victim multiple times in a day. Since human trafficking is under-detected, we hope this webinar will help you understand who may be in your cafeteria, your hallways, your campus, in the grocery store with you. Educators are a critical part of the army against the crime, and numerous encounters between students, staff, with potential victims happen. So you are the front line for us in terms of peer education. The educational role of schools can cover bullying, alcohol, drugs, awareness, physical and emotional development. We want to add to that list human trafficking. So before we get started with the content, we want to start with a polling question, and it's on the screen there. And we ask that you answer whether trafficking must involve A, a movement across national borders, B, movement across states, C, individuals who know they are being trafficked, D, all of the above, or E, none of the above. And Teddy, I'm going to turn it over to you for that.
Thank you, Dr. Rollins. So attendees, please note that the poll is up. You can answer the poll by selecting your answer on the polling tool. We're going to leave it open for about 5 more seconds, and then we'll read results. Okay, so about 70% of you have answered already, so we're going to go ahead and close the poll. And I'll go ahead and read the results. We have 52% that selected all of the above, and interestingly enough, the other 43% selected none of the above. I'm sorry, we have 4% that selected movement across states, 1% individuals who know they are being trafficked, and like I said, 52% selected all of the above and 43% none of the above.
Okay, great. So those who said none of the above are correct here, and I just want to take a second and just go through it for a little bit. So there's something called smuggling, and there's something called human trafficking. And for those who thought that movement across the countries or movement across the countries, that you were really thinking about smuggling. So the way to think about this is smuggling is a crime against a country's borders, and human trafficking is a crime against a person. Transportation is always required with smuggling. Transportation is not required for human trafficking. And smuggling is a voluntary action, and it can be a gateway to human trafficking. And so you can come into the country, smuggle, and end up being trafficked. So I think that was hopefully helpful, because you'll read about it and hear about it in the newspaper, and sometimes they're talking about smuggling when they are really talking about human trafficking and vice versa. Thank you for the poll. All right, so we want to now go to a video. This video was produced by the Department of Justice, Office for Victims of Crime, and I encourage you to look and see what my colleagues in the Department of Justice and Homeland Security have. This video is about 7 minutes long, and I think that it's useful in showing especially the criminal part of human trafficking.
Okay, thanks, Dr. Rollins. Just give me a second. Okay, sorry about that. Give me a second to get the video up.
Sure. So the title of the video is Faces of Human Trafficking, an Introduction to Sex Trafficking. And we're going to get into what sex trafficking is versus labor trafficking later.
Okay, it looks like the video has not loaded onto the platform, so we'll try to get into it later, but let's go ahead and move on with the presentation.
Okay. So this slide, as I said, that video was more of a criminal base. What's happening in the country now is that the anti-trafficking field is embracing the concept that human trafficking is a public health issue. So I created this word cloud, and I put public health smack in the middle of it. And so as you can look at it, you can think about public health and human trafficking. One of the primary beliefs of looking at human trafficking as a public health issue is the emphasis on prevention. And we'll be getting into unplanned pregnancies as part of that. We also want you to just see things in here that maybe you recognize: men's health, addiction, trauma, and injuries. So that's just a word cloud to start to bring our concept away from the criminal part and more toward public health. Okay, and so looking at the different levels of prevention, primary, secondary, and tertiary prevention, you can apply it to human trafficking. So the public health prevention approach does this. It focuses on prevention, interrupting violence and social norms. It recognizes the social and economic determinants of health and well-being that may lead to trafficking. It focuses on protective factors and risk factors, and encourages a cultural-specific prevention and intervention effort. And it recognizes human trafficking on a spectrum of interrelated violence and systemic inequities. So as health peer educators, your work really there is in primary and secondary prevention, understanding and helping victims who may be getting into it or are in it. This is a heat map, and it's the latest heat map off of website. And the redder you see it, the more trafficking calls happened at the National Human Trafficking Resource Center, which is now called the National Human Trafficking Hotline. So there's been a name change. So you can see that human trafficking happens all over the place, and it's increasing. So in 2016, there were over 8,000 calls of human trafficking, and it was a 35% jump from last year, from 2015. And this is mostly due to people spreading awareness about the topic. There is no official estimate of the number of trafficking victims in the U.S. So we base things on calls that come in and cases that are prosecuted. All right, so talking about our numbers, this slide talks about human trafficking in the U.S. So once again, there's no accurate number, but you can see that between 2008 and 2012, over 8,000 calls that came in, 41% were about sex trafficking, and 20% of the labors were referencing U.S. citizens as opposed to foreign nationals. Foreign nationals are not U.S. citizens. So these pie charts are very good at showing you what is human trafficking that's in the country already and what is the human trafficking that is being brought into the country. Now, you got to have a definition slide, and this is it. What is human trafficking? We call it the AMP model, and it's from the Trafficking Victims Protection Act of 2000, and it provides a framework to identify potential victims and help them. So victims of human trafficking are victims of crime, and so there's three parts you see here. You see an action, a means, and a purpose. In a court of law, one of these needs to be proven. If you are over the age, if the victim is over the age of 18, so there needs to be force, fraud, or coercion in order for it to be prosecuted. So there's actions, and we talked a little bit about transportation not being required, but can happen. And then by force, fraud, or coercion for either sex and or labor trafficking. So that's the 8MP model. Force, fraud, or coercion. Let's go a little deeper into what those really mean. Again, remember that only one of these is required for a person over the age of 18 to be considered a victim of human trafficking. And you'll hear a lot more later about physical assault and sexual assault. And coercion is not always chains. It's not being locked up. You can coerce somebody by threatening them, threatening their family, threatening their pets. So coercion is a very complicated and powerful way of keeping control over someone. All right, so now we're going to get into the objectives. That was all background. So here in Objective 1, we want to describe the types of human trafficking and the variety of traffickers that exist in the United States. So trafficking, we're going to start first with labor trafficking. And this slide shows different places where trafficking can occur. And if you think about where you live and what you may see if you are in an urban area, you are seeing a lot of restaurants, maybe construction sites, nail salons. Everywhere I think that there's people who are panhandling and maybe selling things like candy or things like that outside of a grocery store. It's just being real conscious of the diversity of labor trafficking. Often people think just about the agriculture or the sweatshop. We want to broaden your thinking and think about hotels. Sex trafficking. Again, different places where sex trafficking occurs. Strip clubs, often people think that the people in strip clubs all want to be there, all are there on their own free will. That's not always the case. And so also private homes. The internet is very big. You might have heard of Backpage.com, where there are a lot of opportunities for Johns to go on and choose what type of victims they want to have. Major sporting events, such as the Super Bowl or the any major sporting event, also brings a lot of sex trafficking. So who are these traffickers? The traffickers are either big or very small. They can be large scale, small scale. So the large ones would be organized crime, government, gangs, and the smaller ones would be more family focused and individual. So it could be significant others, neighbors, small businesses, local pimps that occur. So when you think about a victim in human trafficking, and I'm in D.C., so I'm looking at the diplomats and the government. It can be in many types of places, and traffickers don't look the same. They are not one race. They are not one gender. They are not one anything. Young, old, anyone could be a trafficker, and so you have to be watchful. So we're going to lead into our next polling question. And I mentioned they can be family. So I'm curious, what % of victims are trafficked by their immediate family? And we wanted you to think about this question. And the first answer would be, let's say, less than 20%. And then B, let's go with 30 to 40%. And then C, over 40%. So again, we're just talking about immediate family trafficking someone in their family. So Teddy, can we do the poll?
Yep, the second poll is up, and you can begin filling in your answers. Again, we want to apologize about the video. It will be made available upon request, so you can view it The GoToWebinar is no longer allowing us to stream from YouTube, but we do have a link for you to check out following the webinar. About 75% of you have answered the poll, so we're going to go ahead and close it out and share the results. So 18% of you believe that less than 20% of victims are trafficked by their immediate family, 60% believe it's 30 to 40, and 22% believe it's over 40%.
Okay, and so the correct answer is 36%, so it would be B, within that 30 to 40%. Getting your mind around the fact that mom, dad, brothers, sisters can be traffickers is a nice way of starting to understand the topic more. So that those who said over 40%, it's not as bad as that, but if you include boyfriends, it does get higher. It's more, as you can see, 27%. The surprise here for me is always on the strangers, 9%. And so this pie chart is based on a Covenant House, which is in New York, one of the providers in New York, and they often come in contact with these underage victims. And so this study asked the youth who were their traffickers. And so, again, 9% were strangers. So the whole stranger danger doesn't really play out, really. It's other people you need to be worried about, really. All right. Objective 2. Okay, so objective 2, we're going to go into a conversation now about high risk factors and common indicators of human trafficking. I want to start by saying anyone can become a victim of human trafficking, any age, any place, any race. But certain populations are more vulnerable, and this slide includes a list of those vulnerable populations. So some things to keep in mind among the diverse populations that you see, children who are at risk of sex and labor trafficking, especially those who have been abused, are runaway, homeless, or have been involved in systems such as the foster care or the juvenile detention system. Traffickers often prey upon racial and ethnic minorities, undocumented immigrants, the poor, people with disabilities. Again, our numbers are not good, but if you look at the survivors and the people being served, you see the ones that are on the screen here. Native Americans are on the screen as well. They've suffered increasing emotional and psychological wounding and historical trauma, which becomes generational trauma. And sometimes the Native Americans are viewed as and advertised on Backpage.com as being exotic. So they, in terms of sex trafficking, bring more money in. So again, I want to end with saying that anyone can become a victim, but we need to think about the people in the system, those with substance abuse and runaway homeless youth as our most vulnerable population. So how does this all break down in terms of race and ethnicity? This slide is from a 2013 report from the Department of Justice study, and it shows that of confirmed sex trafficking victims whose race was known, 40% were black, 26% were white, 24% were Hispanic. And on the other side, for labor trafficking, you see 56% were Hispanic and 15% were Asian. Included in the category of other are American Indians, Alaskan Native populations. So often the media does not really show what is reflected in these pie charts. Often we only see, it looks like people from other countries, white Americans, but really 2/3 of the population being abused are people of color. And I think that this slide is kind of a wake-up call to us. And we definitely need more research. This is one study that was reported, and it's the only study I've ever seen, so we need a lot more research. Okay, I just wanted to talk a little bit about trends. So in the National Child Exploitation threat assessment of 2016, they interviewed 1,000 state, local, tribal investigators, and the survey found that 30% of the responders reported an increase in cases involving gang-led and gang-directed sex trafficking. So it's increasing, and it's also geographically based. Over 1/3 of the responders said that there's an increase in survivor sex incidents among runaway and homeless youth. So there are these reports that the federal government puts out, and we can watch how human trafficking is increasing over time and how it's increasing over time. So in terms of what are the key determinants for sex trafficking, on the left-hand side you see the social ecological factors of being individual, interpersonal, community, and society. There are things called push-pull factors. And the push factors are things that make a person more likely to enter the life, I'll call it, and the pull factors are the things that are pulling them in. And so just looking at the individual level, a lot of the victims start off as youth. I'm not going to quote any numbers in terms of what age they are, but they are young, and they have a history of abuse and lack of education. And poverty you'll see in every row as poverty. And then at the community level, poor economic opportunities and consumer goods. So you have these things going on in communities, and issues like unplanned pregnancy, substance abuse are all part of what the vulnerable person is facing if they don't have certain positive factors in their lives. So what do you look for in terms of human trafficking? What are the clues that a person in a school community, for example, is being trafficked? And we're going to look at each of these, some indicators of being controlled, some red flags, and some physical indicators. So control. There is a handout, and it's on. You can download it. It's called the Power and Control Wheel, and there's many different versions of it. But it has a wheel, and it talks about physical abuse, sex abuse, isolation. So I encourage you to look at that handout. But I also want to just tell you all victims in trafficking are by definition under the control of their trafficker. And the trafficker can exert direct threats through, as we talked about, force, fraud, or coercion. And remember that force, fraud, coercion are not required if the person's under 18. Anybody under 18 involved with commercial sex is a victim automatically. So let's go forward. So look, that's our control slide. Now let's look at some red flags. And this is from the Department of Education. There's an inability to attend school, but often they do attend school, and they're fooling mom and dad or mom and dad about where they really are, especially on the weekends when the comment is that they are at a school activity. There are signs of drug addiction. The victims are coached to respond to questions a certain way. There's bruises, for example, and tattoos of the trafficker. For example, the trafficker's name or the word daddy someplace. So those are some red flags there. More red flags, and we have them here by category of academic behavior, physical, emotional, and social. You won't see all of this, but you'll see some of it. And as we go through this, you might think about people you know, people you've seen, who now you might be thinking, what were you really seeing when you looked at them? Okay, so here's another poll question. What % of victims of human trafficking are seen by healthcare providers while they are trafficked? And the answer responses are, let's say 10% are seen while they are in bondage, or letter B is 30% are seen, C is 60% are seen, and D is over 80% are seen while they are in the bondage situation. And so, Teddy, we can open that poll.
Yes, the poll is open. You can go ahead and start filling in your answers. Okay, we're going to leave it open for a little longer. Again, what % of victims of human trafficking are seen by healthcare providers while they are being trafficked? All right. So we're going to go ahead and close the poll, and let's see the results. Okay, so 39% of you believe 10% of human trafficking victims are seeing healthcare providers. 27% of you believe it's 30%, 28%, 60%, and only 6% of you believe over 80% of victims are seeing healthcare providers while being trafficked.
Thank you, Teddy. That's very interesting. Those 6% who said over 80, you are correct. The actual number, according to one study, is 88%. So let's take a look at this and try to understand. If you are enslaved, how are you going to a doctor and not getting released? So this is a study that was done in 2014, and the respondents were victims of either sex or labor trafficking, and there were a total of 117 patients who were interviewed. And so as you can see, the most common healthcare professional encountered by a human trafficking victim were those working in the ED, in emergency departments, followed by primary care doctors, OBGYNs, and dentists. And so truly, all types of healthcare providers are seeing them. Now, another study indicated that although like 29% of staff understood human trafficking to be a problem, for example, in emergency departments, only 13% of the healthcare professionals felt confident that they could identify, and less than 3% felt trained. So here we have people going into the hospital or clinic, sometimes with their trafficker right next to them, and they're being seen for whatever physical things going on or mental things, and then they're leaving with their trafficker, and that's the problem. So what we're seeing now is more training going on, and we'll talk about that later on. But kudos to those 6% who said over 80%, because that is definitely what's going on. So at this point, I'm going to turn it over to my colleague, Kelly Cody, who is a survivor leader, and she is going to take us through the rest of the slides, and together we're going to do the question and answer period. So Teddy, can you give us Kelly?
Yep, Kelly, whenever you're ready, you can go ahead and begin.
I just want to clarify if everybody can see that green there that says pregnancy centers.
Yes.
Awesome, thank you. So good afternoon. As Rochelle and Teddy have already announced, my name is Kelly Cody, and I'm here to kind of give a little bit more discussion and add to the discussion in regards to and the training on human trafficking. On this slide in particular, the importance of educating others on human trafficking cannot be stressed enough, and I'm certain you may hear it a few more times during this whole presentation. Even as we think about pregnancy centers, education on human trafficking is critical. This could potentially help to save the life of a human trafficking victim, and at the very least, education helps providers to stay informed. So the importance of the pregnancy centers is to make sure that the staff and the professionals are trained, because human trafficking has been identified as a public health issue. it's important for all providers, clinics, and centers to be made aware. An unplanned pregnancy is associated with a trauma bond enforced and/or reinforced by a trafficker. So here we have a little bit more information about that trauma bond and how victims are prey to manipulation. And that's kind of, it talks a little bit about because of their willingness to tolerate anything for a payoff, meaning that they're willing to tolerate the behaviors and how they're treated for that, whatever that predator, trafficker used to get them to kind of be a part of that lifestyle. So trauma bonding is loyalty to a person who is destructive, while the idea of bonding tends to bring up connotations of something good and beneficial. Trauma bonds are unhealthy. According to the author of a book, Betrayal Bonds, there are a number of signs that a person is involved in to identify whether or not they're in an unhealthy bond with a partner. Those are, some signs are constant patterns of non-performance. You feel stuck, you try to change the person, unable to detach from them, and you may even find yourself missing them to the point that longing for them seems to be awful. So that's a little bit maybe trying to understand that bond between a victim and a perpetrator, a trafficker. Here we have, when it comes to unplanned pregnancies while in the life, you have high-risk pregnancies, retaliation, also violence by traffickers and violence by customers. So victims of human trafficking can become pregnant, as anyone else can, at which time this pregnancy can be seen in two ways, as a positive or a negative for a trafficker, and can be a way that the trafficker continues to maintain their control over their victim. During times of pregnancy, the victim can be at a higher risk of the pregnancy being terminated as a result of a violent attack by the trafficker, by a customer, or other additional risk factors when being in this life, or that life rather, and then also to include retaliation of another trafficker or another victim. Here we go. We are on objective number 3. Now we'll discuss a little bit about objective number 3. And in this objective, it will help to identify how human trafficking is a contributing factor to the disparities of health and health care. Let's start by discussing physical and mental health issues associated with human trafficking. As we can see, there are a number of different physical and mental health issues and concerns for persons impacted by human trafficking. Oftentimes, the general public has a common misconception that human trafficking is a physically violent act against another, and therefore the mental health component may be overlooked. As we can see the slide, from the slide, there's a number of mental health disparities as well as physical health disparities of human trafficking victims and survivors. For example, you see here the multiple pregnancies, the post-traumatic stress disorders, the sleep disorders, high-risk self-injurious behaviors, suicide, and accidental deaths, drug overdoses, just to name a few of them from the list. Now, there are certain physical indicators under the category of sexual or reproductive issues that may heighten your suspicions that a person could be a victim of trafficking. These can include, or these include girls, boys, women, and men who are victims of sex trafficking, often suffer from the sexual and reproductive issues, such as chronic pelvic pain, pelvic adhesions, chronic pelvic inflammatory disease, oral issues associated with oral sex, multiple sexually transmitted infections, and that's for both genders, as well as abortion-related complications, unwanted pregnancies or neglected pregnancies, vaginal or anal trauma or foreign bodies, as well as miscarriages, hormone therapy for gender patients. And another issue encountered is that of underage girls who are being forced to take injectable Depo-Provera to stop menstruation, or infections caused by the use of sponges or cotton batting and other materials in the vagina to stop menstrual. So as we see here, this is a pretty phenomenal slide here. I really enjoy looking at this from the perspective of seeing these women or young girls and their progression of age from being a part of the life and going from maybe a youthful look. If you see from going from left to right, they go from a youthful look to looking a little bit, they're aging. And this is over a period of 1 to 2 years of being involved in the life. So it can be, obviously you can see from the images that it can definitely take a toll on your physical health. So just imagine the toll that it's also taking on your mental health. This slide is titled The Erosion of Wellness Over Time. It's just a very critical vision, or just glimpse into the life of those who have been involved in, here they define it as prostitution, so we'll stick to what it says, but for the sake of our training here, this is human trafficking. So objective 4, how can you help? Our final set of slides provides a few referral resources for anti-trafficking efforts that have a health and human services and education focus. In 2016, the Department of Health and Human Services established the National Human Trafficking Training and Technical Assistance Center, a training for healthcare and social service providers called the SOAR to Health and Wellness Training is housed in this technical training and technical center. And it's a pretty good, useful, and great tool to help educate others on human trafficking. And it stands for Stop, Observe, Ask, and Respond to Human Trafficking. And the STOP part, let's talk a little bit about STOP. STOP is, it focuses on describing the scope of human trafficking in the United States. Observe is to recognize the verbal and nonverbal indicators of human trafficking. Ask is to identify and interact with victims and survivors of human trafficking using a victim-centered and trauma-informed approach. And the R stands for Respond, which is respond effectively to potential human trafficking in your community by identifying needs and available resources to provide critical support and assistance. And there's a link there for anyone who may need to use it in the future. Also, we have the National Human Trafficking Hotline. This hotline can be reached 24 hours a day, 7 days a week. It's confidential. It's multilingual. It's for victims, survivors, as well as the general public who needs maybe some guidance or some assistance with a victim or survivor they may have encountered. They will help provide resource information for you as well. And They also have a text line here, which has been very useful. I think this may have just launched in the last 1 to 2 years, and according to information I received from the hotline, it's been very helpful, you know, for survivors and victims to be identified through using their text messaging on their cell phones and being able to delete those messages after they've sent them to the helpline or to the hotline. Here we're kind of just giving you some ideas as to who the referral network is. If you think you've encountered a victim of human trafficking, it's so important to collaborate among key service providers, including local law enforcement, social service providers, and others mentioned on the slide. This helps to ensure victims receive the help and services that they need. The local law enforcement and social service providers can also supply valuable information about the types of trafficking, offering the types of trafficking services offered in your area. This may help when compiling a list of red flags and indicators specific to your local population. So sometimes if you don't necessarily have the knowledge of what's available in your particular area, these other organizations and agencies probably do have information for you to utilize to help potential victims. What can schools do to increase awareness? What can you do? So I use the term the EAPs of human trafficking, and the acronym EAP stands for Educate, Awareness, and Preparedness. So this can mean that it really helps to spread the word through education, awareness, and preparedness. January is National Slavery and Human Trafficking Prevention Month, so why not plan some activities during the month to help raise awareness? Schools can increase staff awareness and educate staff on the indicators and the nature of the crime, educate more on human trafficking, increase parent and student awareness of the risk and realities of trafficking. This has been very beneficial for, I know myself, when I go and I educate at schools, and I'm educating high school students, middle school students, and kind of just doing the basics on what human trafficking is. It really opens their eyes to be able to see something that they didn't know existed and to bring them to light. It's kind of like when we were younger, we were taught don't talk to strangers, and that training helped us at the time to not talk to strangers. So it's kind of reiterating something that needs to be put in place to help prevent our children from becoming the part of the human trafficking world. So how to identify champions? Who are your champions? So the steps we have just covered are components on a human trafficking protocol. In order for this protocol to be successful, you need to find some champions that you can work with effectively. This needs to be a person who has some type of authority to move the process forward within your school system. In developing a protocol, consider reaching out to your local stakeholders and/or victim advocates to assist in the development of a healthy and safe protocol. Identifying your champions and empowering them to develop a protocol is critical to helping victims of human trafficking. So just take, just for a moment while you're looking at this or recapping later on in the day, think about who some of the champions are in your workspace or people who you're connected to that may be able to help in this process and moving it forward. So when you're, this slide is just a little bit more information about protocol and how to create an anti-trafficking protocol. So there's some key points on here that may be of interest when you're creating that protocol. And as you review this slide, there are some steps that can help in developing appropriate protocols. for your anti-human trafficking efforts. In 2015, the U.S. Department of Education released a guide for schools. It's a one-page sample protocol for school districts, and they have 3 main points. One is suspected recruitment of actual exploitation by students. 2 is suspected victim of commercial sex exploitation of children. And 3 is confirmed victim of commercial sexual exploitation of children. So this highlights the importance of the referral network with local, state, and tribal law enforcement and social service providers in your area. Federal law enforcement may need to be involved along with other federal agencies, depending on the case. Engaging with other stakeholders allows for strong support for the victim and the provision of necessary resources. So here is our Look Beneath the Surface campaign. And I say our only because it was a successful tool in my eyes, or it has become a successful tool in my eyes to really bring to light the reality of human trafficking and modern-day slavery. The Department of Health and Human Services has a campaign, and this is it. It's called Look Beneath the Surface. The campaign raises awareness of human trafficking and the factors that make certain populations more at risk. The campaign also empowers the public to help identify victims and connect those victims with services by using that National Human Trafficking Hotline. In 2016, the campaign's message evolved to include images of U.S. citizens, which this is huge because previous campaigns did not include U.S. citizens. And this made the images more inclusive, making trafficking victims or victim identification a little bit clearer. Survivors of human trafficking, like myself, participated in the redesign of this process. I encourage all anti-trafficking work to be survivor-informed and to encourage or to engage a diverse group of survivors and when you're creating programs and public awareness activities. And here also there is additional materials available, which are the training DVDs, the posters, brochures, and also the fact sheets, which are great tools to keep and are printable at that website there. Now in this presentation is when I have the opportunity to share a little bit about my experience. So bear with me for just a moment here as I get to read to you, or rather discuss with you, a little bit about my own personal experience as a trafficking victim to survivor. So moving from being a victim to a survivor to a thriver of human trafficking is has not been an easy task. And for me, the journey into this dark place began at the age of 15 years old. The time of life when, as Eric Erickson puts it, identity versus confusion, the great stage of adolescence. This is when we begin exploring our independence and developing a sense of self. So I did just that. I ran away from home at 15. I thought I was exploring and ended up finding myself with a man who was 10 years older than me, selling me a dream of a great life and the love I longed for since the loss of my biological father at the age of 12. I yearned to be loved and would do anything to find the love from my father. I shared my thoughts with this man, and he preyed, P-R-E-Y-E-D, on me and my vulnerabilities. Now, my childhood started out not so good, as I recall living in our van, washing up in a pan, from about kindergarten to the 6th grade, and watching and hearing my father abuse my mother physically and emotionally, and then physically and sexually abusing me. As I continued to grow in age, I believe that what I experienced as a child was the normal way of expressing love and was apparent in the relationships I ended up in. I would be beaten, burned, nose broken, hit repeatedly, have blackened eyes, held hostage, beat with a shotgun, and still stay with the very man who caused all the pain. During this time of being victimized, I can recall a time that I thought I may be pregnant and was driven to a local clinic to verify my suspicion. My trafficker would not leave my side, and the doctor informed my trafficker that the result was negative. There was no moment of privacy, nor at any time did the physician ask to see me separately. The next time that I missed my cycle and my trafficker believed that I could be pregnant was during the time that my trafficker beat me severely with a shotgun, broke my nose, burned me with an iron, kicked me in the stomach, and told me he was going to kill me and throw me out of the moving car wrapped up in a sheet. Even if I had been pregnant, there would have been no way the fetus would have survived. For some survivors, their experiences have lasted years of horror, and no matter how short of a duration or how long of a duration that a person spends being human trafficked, the journey to healing mentally and physically can take years. I could tell you stories of my life or of the life that would leave you with your jaw dropping and tears rolling down your face. My story is merely one of the hundreds of thousands, and though we, victims, survivors, and thrivers, experience many, if not all, the same side effects psychologically, we still face daily challenges. Our pasts are not merely wiped away because we leave the life. It is what we do with our past experiences that help to turn the dark places into a place of light for us and for other victims and survivors. Let us for a moment envision ourselves as an ant, not an A-U-N-T, but as an A-N-T. Now see yourself as that ant standing on one of the busiest streets in New York City in the middle of a Saturday afternoon. How would you feel? What are you experiencing? The world is still moving around you, and yet if you, the ant, do not move, you will be crushed. This is similar to the way that human trafficking survivors feel when leaving their traffickers. They don't know the world that they are walking into. They are lost. They are worried. They are afraid. They are carrying feelings of shame, guilt, and unworthiness. Survivors are fragile and are exploring a new way of living. Thrivers possess a thicker covering and are able to manage life. When I think of the word life, I think about freedom. Therefore, to call human trafficking the life puts an unreal title or depiction on the truth. Human trafficking to me is a dark place, a place that takes life away and drains those who are victimized of their self-worth, dignity, and value, the very important parts that make life worth living. And that is the end of our presentation. However, I believe we do have one slide we are going back to. Is that correct, Rochelle?
Yes, but there's our contact information if you want to give us a call or email us. And I am a public health advisor within OASH, Office of Assistant Secretary of Health, Office of Disease Prevention Health Promotion. And so you can reach me there, and there's Kelly's information as well. So Teddy, we are available for questions if the audience has any.
Okay, great. So you can go ahead and put up the slides you wanted to keep up there. Okay, and we'll go ahead and go back to your contact information near the end of the Q&A session. All right, so attendees, now is your chance to ask our presenters any questions. There is a questions box on your control panel. Go ahead and use that to ask your questions, and we have a couple. So the first one, Dr. Rollins, can you back up a little bit and address the definitions of sex trafficking versus human trafficking?
Sure. So human trafficking is an overall category, and sex trafficking is one piece of human trafficking. And so if you think about the federal law, there is sex trafficking and labor trafficking, and they are all part of human trafficking.
Okay, great. Thank you. And next question. Can you define what is labor trafficking? And additionally, can both sex and labor trafficking be addressed using the same interventions?
Excellent question. So what is labor trafficking? Labor trafficking, it has the same thing of control issues. It's when a person is being forced to do work for no pay or very little pay. There is a difference between labor trafficking and labor exploitation, and the Department of Labor has a very detailed definition of labor exploitation. But trafficking, if you are coming in from another country, for example, you don't have access to your paperwork, potentially you don't speak the language, you don't know the rules and the laws of the country. But if you remember my pie chart, U.S. citizens are also labor trafficking victims as well. And so I do want to also say that sometimes labor and sex trafficking can happen to one person. So you work, for example, in a nail salon all day, or if you're braiding hair in a salon all day, and then at night your trafficker is abusing you sexually. So that way you are both a labor and sex trafficking victim.
Sorry about that. My phone was on mute. Sorry. If we believe someone is being trafficked, who should we contact, or what steps should we take?
Kelly, can you answer that?
Well, when I have encountered people who have been trafficked, I have encouraged them to contact the hotline. However, that is not always successful. I have contacted the hotline to be able to provide the best resources to the person, because they will give you the resources in your area to provide to the person who is a potential victim. Always remember to be honest with a person who may be victimized. Do not lie to them. Do not be dishonest with them for any reason, and keep them aware, and always make sure that they feel like they're in a safe place, because if they do, then they will disclose.
And I just want to say that the number for the hotline, we had it several times in the slide deck, but we didn't verbally say it. So 888-373-7888.
Thank you both. Could one of you talk a little bit more about the Look Beneath the Surface campaign, and also if there are free resources available you can that come to mind you can give to our audience?
Sure, I'll take that. So the Look Beneath the Surface is the HHS campaign, and at the link that you see on slide 44, you can go onto that link and order some materials, but they also, like there's posters and things like that. They in the past, you could order in bulk, but that has recently changed. So I encourage you to go and look at that link and look at the different posters that are available and brochures that are available in different languages as well. Now this campaign is HHS. There's also something you might have called the Blue campaign. Have you seen him? Have you seen her? So in addition to talking about HHS, I want to encourage you to look at the Blue campaign. You can Google that and see their materials, because they have videos as well. Of course, they're more justice focused, but all parts of government are working to help end human trafficking.
Thank you for that, Dr. Rollins. To answer a previous question, this presentation is being recorded and it will be archived. And everyone who registered, even those who weren't able to attend, will receive an email with a link to the archived presentation. So we have a question for Kelly, and she can answer this and maybe expound onto some best practices. But the question is, what are some ways your healthcare providers could have helped you possibly get out of your situation?
Can you hear me okay, Teddy?
Yes.
Okay, fantastic. So remembering that, you know, over the years, human trafficking has totally shifted, and the look and how we are acknowledging it as an issue has changed a lot of what we see now than what we've seen then in the healthcare setting. One thing that always stands out to me is the fact that it would have just been simple to make sure that I had a right to privacy. Had that very thing taken place, that may have been the moment for me to feel safe enough to disclose what was happening to me, and then maybe someone could have come and done something. So that separation, and when I've done trainings with healthcare professionals, I do emphasize the separation between the trafficker and the victim, even when you may not think that the person may not even be trafficked. It could just be somebody's older boyfriend. There still is a right to privacy, and that separation should occur. And so that is, I think that would have been the first step to helping bring about change.
Thank you, Kelly. Just to let the audience know, we also have copies of today's presentation in the handout section of your GoToWebinar control panel, as well as the power and control wheel example. And Dr. Rollins, could you talk a little bit about that power and control wheel and what the audience will see?
Okay. You will see a wheel, and at noon it has sex trafficking, and at 6 o'clock it has labor trafficking. And all around the wheel you will see the types of places that human trafficking occurs, in businesses, farms, strip malls, streets, online. So basically what I had in a different slide of where it occurs. Then on the inside of the, as you can see on the screen, on the inside, you see different ways of controlling and different experiences that the victim is having. So I'll start over here in physical abuse, like at 7 o'clock. And what strikes me here is the forces pregnancy termination or induces drug addiction. We didn't talk at all much about the drug addiction, but that's one way of controlling a victim and making them not really conscious of what they're doing. And on the other side, sometimes victims decide to do the drugs because it's a way of numbing themselves. They know what's happening and they can't believe it's happening, and so it goes both ways. It's used as a way of abusing, and it's also a way of coping. Under sexual abuse, it's the last thing there, the normalizing sexual violence and selling of sex. This is a crime, and this is all about violence, and it's about power and control. And so if we think about it like that, we can think about it in the same spectrum as rape and child abuse. And it's just amazing that as a country, we'll talk about rape and domestic violence, but we don't talk about our most vulnerable populations, which are our slaves. And so in the center is just the term power and control, which connects all of these ways of these realities that victims face.
Thank you, Dr. Rollins. We have time for a few more questions. I'm going to combine a number of questions. We've had a flood of a few questions that deal with protocol. We have some attendees who they believe they have been approached by possible victims of human trafficking, and they would like to know what protocol should they follow when addressing a minor or a grown person, someone over 18, when it comes to reporting or assisting them. Should they give them money when asked? Should they contact the police, or should they contact a hotline, or a combination of all three? This can go to Kelly and then Dr. Rollins.
Okay.
Well, do not contact the police unless they're asking you to call the police. And the only reason why I say that is there is a stigma or a trust issue with trafficking survivors and police officers. So unless they're asking you to do that, and you're mandated by your state, which every state is different, and I don't know of any that make human trafficking a reportable offense. So be careful when you report and who you report to. Always remain available to your trafficking victim. When you say give them money, what are you saying, like in reference to what? Like, are they asking you for money to make a phone call? Are they asking you for money to catch a bus, to get away from their trafficker? If that's the case, then maybe contacting your local bus depot, Amtrak, Greyhound, letting them know, that you would like to find out if there's a way that they can help provide maybe a free bus ticket. I mean, there's different ways that you can approach that, and definitely giving them the phone number and the text number and remember the number is a toll-free number, so they can use any phone to call the hotline, and the hotline has techniques. I mean, they've talked about how they'll have a trafficking victim tapping on the keys to spell out letters if they need help. I mean, they have strategic ways of helping victims and making sure they have a new rule that they will not get off the phone with the survivor or the trafficker, A, unless it's a safety issue, and B, until that person is in a safe place. So they're trained professionals that know what they're doing in that area. So Rochelle, do you have any other feedback on that?
Sure. So the hotline, my answer begins and ends with the hotline, because I do know how professional they are and how they can know the resources that are right there in your geographic area. So they map out the resources across the country. And so they can tell you where, Kelly mentioned getting a ticket, for example, to get out of the geographic area. The hotline might be able to help with that. The other thing that I don't think we stressed enough was this is a process for victims to leave. And so the best thing you might be able to do is just say, I'm here. If, to continue our conversation, I want you to know that you can trust me. I want to get you to a safe place. We don't use the term rescue anymore because of feedback we receive from survivors like Kelly. I use the term escape because it might not happen the first time, second time, third time, but as that trust builds up, it can happen. And so I always say we end trafficking one person at a time, and it takes time to do it. But the first thing is you can't fix something unless you talk about it and you see it. And so that's where we are in terms of our awareness. I think as a country, we're about 30 years behind domestic violence. in terms of our awareness and understanding of what to do. But we will catch up as a field. Anti-trafficking field will catch up. And I think that webinars like this are a first step to expanding and connecting health disparities and crime of human trafficking and thinking about the impact on society as well as the impact on the individual.
I do want to add to that, Rochelle. You did bring to light that it is a process of to leaving. It's very similar to that of domestic violence. Not that this person just has this desire to want to go back. It's a process to leaving. This trafficker, this is the trafficker's property. You belong to a trafficker, which means that majority of them, by any means necessary, will acquire you back. It has happened to me. I have been involved in it. I have fled and went 8 hours away, and my trafficker appeared the next day and brought me back. When I was taken into a residential treatment center as a teenager, my trafficker called the psychiatric hospital, which I have no idea to this day how he knew where I was, to try to locate me. And he also contacted the residential treatment center, with 3 states away. So you are that person's property, and they will locate you. So it is a process of leaving. And at that point, just like domestic violence, it is very dangerous for the victim and also those parties that are helping them to flee their situation.
Excellent. Kelly, can you go ahead and go to the last slide so we can show the audience your contact information, you and Dr. Rollins. And while you do that, we have a question. Do you have advice for attorneys who would like to provide pro bono legal services to trafficking victims? Are there organizations that attorneys can volunteer or join to assist with trafficking victims?
You can contact the hotline, and they actually, even for nonprofit organizations that are beginning, that are started, that are not linked to the hotline, they can actually call the hotline and become a part of the hotline, as well as legal assistance. The hotline will give you, I know for, in terms of immigration, we didn't talk about that, but there are situations where people find themselves in human trafficking situations, and it's affecting, or rather, their immigration status has something to do with their the reason why they're stuck in that situation. So there are attorneys that are also linked to these hotlines, or to this hotline rather, that they can contact to get assistance. So attorneys can contact the hotline, get on board, contact any of your local human trafficking agencies that are in your area, and let them know that you're willing to provide a pro bono service. I mean, that's one thing, that is something that we do need more of, and we do need. So I definitely encourage it.
And I'll answer as well. So there are also task forces all over this country at the state and city, sometimes county level. And there's law enforcement. These task forces were set up by the Department of Justice. So if you were to Google task force in Silver Spring, Maryland, I would come up with Montgomery County Task Force, and I could contact them and learn about resources and get involved with the task force. I just want to put that out there. And also, we mentioned hotlines. There is one national hotline, but there are also many other hotlines that are survivor-led. But if you want to get attached to national resources and have a national view, then we ask you to call the number of the 888-373-7888.
And you can also go onto their website, the National Human Trafficking website, and they you can put your state in, and it will give you a list, a physical list for those people who are visual like myself. It will give you a physical list of all of the agencies that are in your area that provide services.
Thank you both. And we have one final question I felt was important. The attendee stated, when I think of trafficking, I think of being taken. And I would just like to, like Kelly, to emphasize this point. When I read the question, I thought of the movie Taken. You know, these girls go to a foreign country and they're taken by, you know, a large underground ring of traffickers. But as we learned today in the webinar, oftentimes it's a close family member that's involved. And so can you just, again, just so, you know, we have a better conception of you know, what occurs and we can recognize it, we recognize it for what it is. Can you just go ahead and delve into what are more common occurrences, more realistic occurrences of human trafficking and sex trafficking?
So,
how does it look?
I mean, I love the movie. It's a great movie, right? It gives you a little bit of insight into the world of trafficking. However, it doesn't do a very good depiction for us here in the United States. Like Rochelle, can I go back? I'm going to go back to the slide with the bar chart. I apologize for it going so fast. I don't mean to give anybody a headache. Right here, the Covenant House study. And one thing I wanted to reiterate on this slide, and it may help to answer the question, is that people, it does say 9% strangers and 27% boyfriends. And when you're asking someone who is a survivor or a victim of a crime, their connection to the person, for us, the connection was boyfriend. For the general public, that person could be seen as a stranger. But this didn't ask the general public the question. They asked the survivor or the victim what they seen the person to be. So we very well don't necessarily know the man or the woman that betrays us and gets us into this lifestyle, and could be very well classified to 90% of adults with children and non-children in America as a stranger. But for us, we're thinking they're our boyfriend. You were my boyfriend. I thought I knew you. I thought I knew everything about you. I thought you loved me. And if you love me, that has to mean that you're my boyfriend. You're not a stranger. But we know that is not necessarily the truth. That person could have very well just been a stranger, and they were a stranger, but we've seen them as a boyfriend. So in the United States, where you see it's family and friends, it's immediate family, it's boyfriends, we've seen cases that, where we have people who are our children that are in foster care, and they are being trafficked out of their own homes, their foster care homes, to strangers. And it's their immediate family, which we call them immediate family, but they're actually their foster parents that are doing this to them. And then we have biological parents who are trafficking their children for drugs or for a number of other reasons. But just, that's, unfortunately, that's the United States. That's what we're dealing with here in the U.S. Rochelle, did you want to add to that in any way?
Well, there's so much more that we wanted to share, and I would just say gangs. There's also a lot of gang activity in the United States, depending on the geographic region, and that's another whole way of looking at trafficking. And so if you're interested in learning more about this, there's terms that you need to learn, like bottom, and what a bottom is, and what that bottom means to a victim. Kelly, quickly, what is a bottom?
She's the number one. She has earned her stripes. She is his right hand, and she will do anything for the trafficker and to appease him in any way. And she has definitely spent a lot of time and energy and beatings and a number of other things, and can recruit other girls, that is the bottom.
Girls and boys. So we have so much more. We encourage you to learn more about this health equity topic and think about topics like unplanned pregnancy in the context of trying to fight for your freedom.
All right, and that concludes today's webinar. I would like to give a great big thanks to our panelists. Really great information, and I would like to remind all attendees that there will be a follow-up email. Within that email, you will find a link to this archived webinar, as well as a survey. It's very important that you do participate in the survey because it allows us to provide great content like we heard today to all of you. So again, thank all of you for joining us. Thank our presenters for spending a great deal of time with us today and presenting us with all this information. And with that said, we will conclude today's webinar. Have a great day.
Have a great day.